Hello and good afternoon. My name is Zulima Chavez, and I'm the Support Center Manager for the Asthma and Allergy Foundation of America, or AFA. This episode is produced independently by AFA. Today, in honor of Maternal Health Awareness, we're continuing our conversation about managing asthma and allergies during pregnancy with Dr. Jennifer Namazy. Dr. Namazy is an allergist immunologist at the Scripps Clinic in San Diego, California, chair for the Women's Allergy and Immunology Committee for the American Academy of Allergy, Asthma, and Immunology, also known as QuadAI, and represents the QuadAI for the Vaccines and Medications and Pregnancy Surveillance System. Dr. Namazi, welcome back and thank you for joining us on today's episode.
Hi, Zulima. Thank you for having me back. I'm actually past chair now. This is my first year off the committee, but I'm still actively part of the committee, and I'm really happy to be here to talk about one of my favorite topics.
Yeah, and we're so excited, and I'm looking forward to jumping in. Last season, we discussed the importance of managing asthma during pregnancy, and about 40% of pregnant patients will experience worsening asthma. So, as a recap for our listeners, why is this an important issue, and what happens when a person's asthma is not well controlled during pregnancy?
Yeah, this is a tremendous issue, not just in the United States, but globally. We know now that having uncontrolled asthma or severe asthma during pregnancy can lead to bad outcomes for mom and baby. And so it's really, really important, even in the family planning stages, that you get your asthma checked with a specialist or your primary care physician, get the medications you need, and make sure that you enter pregnancy as controlled as possible. And that's why, it's a real public health issue.
Yeah, it definitely is. And with pregnancy and asthma, what are some of the asthma signs and symptoms to look out for? So you have your general asthma symptoms, and then you have ones that you specifically see during pregnancy. And what are those?
Right, right. For the majority of symptoms, they tend to be very similar in pregnant asthmatics as well as non-pregnant asthmatics. So coughing, wheezing, shortness of breath, chest tightness. But there are some subtle differences during pregnancy that you might not be aware of. For instance, decreased fetal movements. So when the baby's not moving as robust as it should be, could be an indicator that it's not getting enough oxygen. And then when your asthma becomes even more severe or uncontrolled, you might have vaginal bleeding or more headaches that can signal that things are not going well. A couple of years ago, we came up with the Breathe for Baby toolkit, and this was a great collaboration between our organizations. And so we do have the first ever asthma plan during pregnancy and lactation that really highlights those symptoms.
Yeah, these are great things to look out for people to be aware of. Their asthma before they're pregnant, they may have seen very specific symptoms. And then once they're pregnant, they would see some of the symptoms that you mentioned. So I really appreciate you mentioning that so people are aware. And if you do experience these symptoms, make sure to reach out to your primary care provider, your reproductive health specialist, whoever you're working with, to have a conversation, get that checked out. We want to make sure that both the person who's pregnant and their baby is healthy and that we really support healthy birth outcomes.
That's right. I mean, the important thing is getting enough oxygen to the baby, getting enough oxygen to the baby so that it can grow, and that your pregnancy can go without complications as well. And you can have a healthy baby at the end of it.
Yeah, definitely. And there are different steps that people can take to manage their asthma and prevent flare ups during pregnancy. One of those steps is getting vaccinated. Can you talk more about that?
Right. I think at this point, we're very familiar with certain vaccines during pregnancy as they apply to asthma. We really have to look for viruses that could lead to poor outcomes or asthma exacerbations, making your asthma worse, which is not good for the pregnancy or your outcomes and baby's outcomes, right? So we have really good data over the years in terms of the safety and efficacy of flu vaccines, COVID-19 vaccines during pregnancy. But I wanted to highlight what maybe some people don't really think about in terms of an important respiratory virus during this season right now is RSV. It's the respiratory syncytial virus. And it is actually, the vaccine is available to pregnant patients during their third trimester, anywhere from 32 to 37 weeks gestation. That's one dose, and not only helps mom should she develop the virus, but protects, more importantly, protects the baby. We know that globally, RSV is one of the most important upper respiratory tract infections that can affect infants and young children. And here in the United States, there are about 80,000 hospitalizations for children under the age of 5. And so we know that maternal vaccination during that last trimester improves outcomes in infants from developing the infection, and also a significant reduction in hospitalization should they become sick. So it is an important vaccine to think about, especially if you're in that profile during the RSV season here in the United States, which is largely between September and January.
Yeah, and for our listeners, if you are pregnant and have asthma and you want to learn more about vaccinations, if you have questions, concerns, this is a great opportunity to check in with your doctor to continue that conversation and see if this would be a good option for you. And another step to managing asthma flare ups is taking your medications as prescribed by your doctor. Dr. Namazi, what are the changes that patients can see in their treatment or management plan during pregnancy?
I am a big supporter of self-management. I think it's very important to put control over your asthma, the medications you take, and having the dialogue with your providers in terms of your care. I think we really need to go away from telling patients what they need to do, prescribing things without really having that bidirectional dialogue. It's really important. It's a shared decision making process. So I think it's important, if you are even thinking about becoming pregnant in the next year or two and you have had a diagnosis of asthma, even if it's mild, even if you're only using a couple puffs of your rescue inhaler when you exercise, I think it's important to bring up the fact that you have asthma with your physicians or specialists, healthcare providers in general, and really have that discussion about what it means to have asthma going into pregnancy, what medications are safe to use, and what medications you should have available to you. So I'm a firm believer in the earlier is better, but that doesn't mean that, should you become pregnant, that you can't have these discussions. But I think it's important, self-management is important, and it's important to have the tools to really assess your asthma. We have available, like I had discussed earlier, the asthma plan, which is a shared communication resource between all of the people taking care of you: obstetricians, allergists, pulmonologists, primary care physicians. They can all kind of come together to really take care of you better. But also having tools available to you to really assess your asthma control during pregnancy, like an ACT, the asthma control test, or an AirQ. There are a variety of tools out there where you can kind of look at your general symptoms on a week by week basis and see if there is perhaps a loss of control. So there's a lot of information out there. But I think as physicians too, that take care of pregnant patients, we actually have to have a multi-directional approach to care. We have to communicate with each other, right? It doesn't just end in our office. We have to communicate with obstetricians, pharmacists, maternal fetal health care providers to really have more of a cohesive approach in caring for these patients.
Yeah, and I love that you mentioned so many different components of this. There's the shared decision making, there's the partnership between a provider and a patient, making sure that patients feel supported, empowered, understand the importance of taking their medications. Are they taking them correctly? Do they understand all of that? And do they really feel heard, that their needs are being met by their provider? And lastly, If people are working, they have their primary care provider, they have an allergist or pulmonologist they're working with, their obstetrician, making sure that all of those providers are on the same page with the goal of making sure that this patient is managing their asthma well during pregnancy, that they feel empowered, and again, really understand when should I be taking my medications? When do I need to seek emergency care? When is my asthma not under control? And so these are all really important things for people to consider in their journey when managing their asthma.
Right. Education is so important, right? And I really feel and truly believe, and there's the data to support this, that when patients are more educated about their asthma symptoms, about the medications they need to take and why they need to
Right.
take them, then they feel comfortable and more adherent to the treatment plan. So if we can provide all the resources and tools and educate and answer questions and be there for our patients, I think that they will feel more comfortable. Adherence is a huge problem during pregnancy for a lot of different health conditions, but asthma, foremost. Because there's this fear of taking medicines and what the effects are going to be on the unborn baby. So I think if we can
Right.
head off and provide that information that is based in research that has been shown to give us the information we can give, that is just going to be more helpful.
Yeah, and for more information about managing asthma during pregnancy, we encourage listeners to visit our website, afa.org/pregnancy. There's a lot of great tools on there. And one of the things Dr. Namazy mentioned was the action plan. You'll see one on there for pregnancy and lactation. So check that out, print it out, and take it to your next doctor's appointment. And another aspect of managing asthma is avoiding allergens. This is very important. And some allergens include examples like dust, pollen, pet dander. What steps can people take to manage their allergies during pregnancy?
Right. I think a lot of people don't really think about triggers, environmental triggers. It's very important, especially if you have allergic asthma during pregnancy, to really be aware of what those potential triggers are. Seeing a specialist and potentially prior to pregnancy or even during pregnancy be assessed to what might be the allergens that sensitize you, that make you feel allergic or make your asthma feel worse. But you did highlight some of them. Pet dander is very common, and there are things that we can do to control pet dander in the environment, such as having air purifiers or frequent washing of pets. There's also dust mites, like you mentioned, putting dust mite protective barriers on the mattress and pillow, mold avoidance, cockroach avoidance. These are all different things that we can do in the environment that might be important triggers for your asthma.
Yeah, and I'll include a plug here. We have a healthier homes checklist and an asthma friendly home checklist. These are two incredible checklists that I like to mention often that have a list of the different triggers that you'll find in a home and ways to improve and remove these triggers, as well as improving the indoor air quality in a home. So if you're looking for ways to make these improvements to your home, make sure to check these out. And again, we'll include the links in the description below. Now, we'll take a step back. If someone is thinking about having a baby and they have asthma or allergies, what are some steps that they can take to prepare for that? What are those conversations that they should be having with their doctors?
Right. So just kind of coming back to the point that starting earlier is better. It's never too early. Even if you are thinking about, planning a family in the next 2 years, 3 years, it's always good to check in with your physicians and talk about your asthma, whether it is going through your medications and asking questions about safety profiles during pregnancy, to having lung function assessments, to making sure that your baseline lung function is normal prior to entering pregnancy. There are a lot of things to do, but I think the most important thing is to really make a list of questions right? Make a list of things that you're concerned about in terms of your asthma. You might ask your physicians, what kind of bad outcomes could happen to my baby or myself if I didn't take my medicines? What are we talking about exactly? What's the worst case scenario? But having an asthma plan in place as well prior to pregnancy was really, really helpful, because then you can begin kind of tracking and planning, tracking your symptoms, and also having a firm plan in place should things go south and you develop more symptoms. What would be the next steps?
Yeah, that's very important. And a tip that someone told me: on your phone, the Notepad app, that's a great place as you think of questions, put them there, because sometimes I'll write stuff on sticky notes, lose them. And so, you will most likely always have your phone on you at your next appointment. So remember to write those questions, like Dr. Namazi said, bring them and have those conversations. And now, another question with just about any other condition that people will ask is, can a person pass their condition to their baby? So, in this case, if you have asthma or allergies, can you pass that to your baby, and what factors influence that?
Yeah, that's a very complicated question too, because it's a complex kind of connection between genetics, right? What's inheritable, and also environment, which you're exposed to. And it's those two things that come together that can really influence the development of allergies in children, right? But kind of getting a little bit more simple is that having pregnancy, having asthma during pregnancy does put your child at an increased risk of having asthma. And that is, largely genetics, but also kind of the environment prenatally and postnatally as well. But it can vary from the microbial encounters that infants have, to the genetics from parents, to the environment that they live in, whether they have pets or the other environmental exposures. All of that kind of plays a role into what how allergies are developed. And we're still spending a lot of time researching this because it's very important.
Yeah, definitely. And earlier you mentioned the Breathe for Baby toolkit. So I want to take a moment to talk about that program. This was a project done in collaboration with the American Academy of Allergy, Asthma, and Immunology, and we developed the Breathe for Baby program. For those who are not familiar with this program, can you share what it is and the resources it offers?
So what what we've been talking about is really this multi-directional approach to care. We do have a lot of data showing that when primary care physicians, specialists, obstetricians, pharmacists, when they all get in the same room to care for a patient, they have better outcomes and fewer exacerbations. So that really kind of brought to the birth of the Breathe for Baby toolkit, which includes the asthma plan for lactating and pregnant patients, a pregnancy validated ACT or asthma control test that can be used during pregnancy, and then a multitude of educational material. Right. So we also have one of the first cohesive tables on the safety of biologics, asthma biologics during pregnancy. And so having all these resources is really helpful. And it provides education to the patient, education to all of the healthcare providers as well. That's all downloadable in English and Spanish online. And really, we envision it to be used by community healthcare workers, physicians in training. It's a whole learning process, but I think in the end, it will lead to better care and better outcomes and better adherence to medicines by our patients.
Yeah, this is a great program with a variety of resources. Like you mentioned, providers can use this in their practices. If you're a community health worker or outreach worker and working with people who are pregnant and have asthma, it's a toolkit that you can use out there as well. And also for patients and caregivers as well to really educate themselves on this issue and tools so that they feel more empowered in their journey to manage their asthma during pregnancy, why it's important. And I'm also excited to share that we have released a pregnancy and asthma social media toolkit to promote the Breathe for Baby resources as well as the important issue that we're talking about today. It has a lot of great information and graphics that can be shared on social media channels. January 23rd is Maternal Health Awareness Day, and February is Reproductive Health Month, but you could share this content year round. So we encourage you to share these resources with friends, loved ones in your practices, get the word out there. There's a lot of great tools in there that could really help to improve health outcomes for both mothers and babies.
That's wonderful. It's the first time I'm hearing about the social media. I'm going to follow it and refer my
Yes,
patients for sure. This is great.
definitely. Yeah, and you can find it on our website. Again, we'll include links below. Dr. Namazy, thank you so much for joining us today to discuss the importance of managing asthma and allergies during pregnancy, as well as the Breathe for Baby resources.
Thank you so much for having me again. And I really enjoy talking about this. I'm very passionate about this. And I can't say enough about that there is support for you out there. And there is a lot of information. And I hope that through this you can find the resources you need.
Definitely. This has been a great conversation, very insightful and informative. And I look forward to having our listeners here, and it'll give them a lot to think about as well if they're thinking about getting pregnant, if they are pregnant with asthma. Lots of great resources and information. We hope our listeners of the Afternoon Chats podcast found this informative and actionable. Don't miss our future episodes, and remember to like and subscribe to our podcast, available wherever you listen to podcasts. The information presented in our podcast is educational and not intended to provide individual medical advice. Please talk with your healthcare provider for advice about your personal health. If you have questions or want to talk to someone about asthma or allergies, our Asthma and Allergy Foundation of America online community is always open. You can find it at aafa.org/join. Have a good afternoon, everyone.